Thank you, Madam Chair Eshoo and Ranking Member Guthrie. This is an important hearing, a topic of telemedicine. As a physician myself, I understand the increased telehealth services during COVID-19 has spurred substantial changes, positive changes in the delivery of healthcare. Last year, when in Congress we acted to provide the Secretary of HHS with additional flexibilities surrounding telehealth, I don't think any of us envisioned the full impact that this would have. The pivot to telehealth has raised many new questions surrounding patient care, access, rural availability, specifically in broadband, and even privacy and security issues. I want to thank the witnesses for appearing today and for answering our questions. Dr. Resnick, as another board-certified dermatologist in this conversation, you and I realize that derm is a very visual field of medicine, and visual access to patients is sometimes all that's necessary for an evaluation, diagnosis, and treatment. But this isn't always the case with all subspecialties, specifically surgical subspecialties, which our Chair Eshoo talked about, that surgeons aren't going to be doing these procedures via telemedicine, but also in obstetrics. Do you see any long-term consequences for these fields, given the shift that we all know is occurring to telemedicine?
Thank you, Dr. Congressman Joyce. So I think every specialty has found its places where telemedicine can be useful. So you mentioned surgeons. I have surgical colleagues who their patient gets discharged from the hospital, lives a couple hours away, and maybe they do a post-op visit via telehealth. So every specialty is figuring out this, okay, this is where telehealth does not work for me, and this is where it does. You and I are both dermatologists. Sometimes a still image can be way more useful than a blurry video for us. So I'm grateful that we have a variety of codes to use, including the e-visit codes, where a patient can upload really high quality photos into my EHR portal for me to look at. So I think having a variety of tools at our fingertips, the continuation of every specialty figuring out where this is useful and isn't, is going to bring us to a place of ongoing progress here.
I certainly enjoyed hearing about your treatment of the patient with scleromyx edema, knowing how complex with the cardiac and pulmonary that you required ultimately that patient be brought in hospital for ultimate care. But your ability to keep that patient working is significant. I also wanted to address another issue that I think is important, and that is the training of residents and medical students in telehealth. And I'll ask the physicians on the table at this conference. Dr. Mahoney, do you think that should be integrated as part of training both to medical students and to residents?
Thank you, Congressman Joyce. This is an excellent question. I wholeheartedly endorse and am enthusiastic about integrating telehealth and more modern modalities of care into the training of medical students and our residents. We really do need to prepare for the next generation of providers, and we need to ensure that they're empowered with all of the knowledge to do so effectively. We have been training our residents. We've been bringing them in either in the visit that we have with the patient directly so they can observe. They are able to see patients directly. We can conference in as attendings and observe, and then they can also have one-on-one appointments with their patient and then present to us later depending on their level of training. But absolutely, I endorse that recommendation.
Dr. Mahoney, do you recommend this as a requirement to complete residency training?
I am not an expert in that field, but I am very enthusiastic about that idea, absolutely.
Dr. Mahatra, would you weigh in on this as far as medical students and residents' requirements in telemedicine?
I think it's a key point, and it's already happening. Let's be clear. Just because as you know, residency is often an apprenticeship. You follow attendings around and you see their care that is being provided. And as all of healthcare has moved to telemedicine, I'm seeing so rapidly how education is moving in that direction. So I'm very enthusiastic and excited about how the future will incorporate telemedicine in training.
Thank you all for being present, and Madam Chair Eshoo, I will return my remaining 12 seconds.